The session was about functional imaging. Are we talking about a paradigm shift or a pipe dream? We're all used to anatomical imaging giving us information about the anatomy inside, but more recently functional imaging techniques have become more advanced, and we're able now to get information about tumors that helps us to characterize them, that helps us to assess different types of response and get a better idea of the heterogeneity of tumors and how they differ in their behavior and in their response. So what we talked about in the session were three very different areas. One is, what difference does this make to clinical decision making? How can we introduce functional imaging into a clinical pathway of patients? Then we talked about molecular targeted agents and how we can recognize tumors by specific molecular targets and then use those targets to administer specific targeted treatments. And then finally we talked about quantitation of functional imaging. Was it sufficient to just look at the images to say, yes, this tumor has responded or not? Or do we need to actually get more quantitative data out of the image, different metrics that aren't visible to the naked eye, but that help us to understand how a tumor is changing, evolving with time, or responding to treatment? So there were three very different talks, and there was quite a lot of lively discussion around each of those topics. And then we finally had two profit papers from two groups, one in Manchester, the Christie Hospital, talking about FLT PET in pancreatic ductal cancer, and then another profit paper on MRI in prostate cancer from a large trial called the PROMISE trial from University College in London. In the first case where we talked about whole body diffusion in MRI, we discussed how this might actually shift clinical decision making, at what point in the pathway this imaging needed to be introduced in order to make those decisions. In the second case, we talked about what available molecular targets there were, how frequently we should image, and how we could perhaps image the evolution of cancers. And in the third case, we talked about whether numbers matter, what kind of quantitation we should do, how complex it was, and whether it was more meaningful than ordinary visualization of the images.